We are joined this morning by speech therapist Emmy Fulgham and physical therapist Carrie Cochran to talk about a Parkinson's treatment being offered by SAAD Healthcare. Good morning, ladies.
Good morning.
Thank you very much for joining us here on Studio 10. Now, before we get into that treatment that we're going to talk about today, let's start with some general information. What is Parkinson's disease?
Well, Parkinson's disease is a progressive neurological disease, and mostly you start seeing the signs and symptoms of a shaking hand, a head, the face, the jaw. Sometimes it can even be in the legs that shake. We also notice low voice, and then they start having problems with balance and slower movements.
All right, and today we are talking about that groundbreaking treatment, and it is called LSVT therapy. What is LSVT therapy?
Well, it stands for Lee Silverman Voice Therapy, and it was designed by two speech pathologists that were doing research to find a better way to help patients with Parkinson's and other neurological conditions. So there's a speech therapy component and a physical therapy component that focuses on voice, thinking loud, as well as physical larger movements to treat these patients.
Tell us a little bit more about the therapy. What's involved in it? How do you get the results from this therapy?
Well, it's two components. There's big, which is the physical therapy component, and loud, which is the speech component. So what we try to do on big is focus on larger, bigger movements. Have the patient move in a bigger way and let them really feel that. And with speech,
we focus on loudness. So patients with Parkinson's often have a decreased loudness, monotone, hoarse voice that really affects their ability to communicate. So what we focus on is increasing that loudness and carrying it over into daily life so that they can be heard and understood and carry on their social activities.
Well, I think one of the most important things about this is if this is a good treatment for somebody, how do they get started with this process? How do they make this happen if this is something that could help them?
Well, the first thing you want to do is get an order from your physician. Just be in contact with your doctor. They can send the order to us at SAAD's. If you have questions, you can call us at SAAD's, and we can help you maintaining getting that order from the doctor. So just be in contact with your physician.
And I think you mentioned this a little bit earlier too, but it sounds like this therapy can be applied to other things as well. Can you talk a little bit about that?
Yes, well, it was designed for patients with Parkinson's, but we found that with other neurological conditions, if we do a test of 1 week therapy, it's normally a 4-week program, and every time we've done it so far, we have seen improvements in that 1 week, and then we'll continue on after that if they have other conditions besides Parkinson's.
All right, so we're talking a lot about this morning, and I'm sure a lot of people are very interested. How do they get in contact with you guys? What's the best way to go about that?
Well, you can call us at SAAD's. Our number is 343-9600, or you can come by the office. We're at 1515 South University Boulevard. We have our brand new outpatient facility clinic there. We do our treatments there. We do also offer home health for those who are homebound. But call us, and if you have any questions, we would love to talk to you, Emmy or myself.
Sure, and all of that information too will be posted on our website as well, so you can just go to the Studio 10 tab on fox10tv.com and get all that important contact information. Ladies, thank you so much for joining us this morning.
Thank you. Thank you.